Hello, doctors. Welcome. Just let me know where you are joining me from, um, so that we know exactly where we what we can do to help. Let me know where you are joining me from. And please let me also know whether you can hear me live. I'm also going to go live on TikTok as well. So just tell your friends who are on TikTok that they can also join us. Okay? That they can also join us. I'm going live on TikTok. So please just give me a few seconds. We are just going to go live on TikTok, and we'll see how things go from there as well. I don't know how to do it, so just give me a few seconds here. I'm just gonna go live on TikTok, guys. Okay, let me see. Let me see. How do we go live on TikTok? Okay. Okay. Yeah. We're going live now. Yeah. Okay. So those who are joining us on TikTok as well, we are live currently on YouTube. So you can join us currently. We are live, and today we are going to discuss burns. And I have people who are joining us from BC, from Edmonton, and then Afghan TV magazine. Sure. So doctors, please just tell your friends to join us. We are just going to go through burns right away. Because if whether you're in medical school, whether you are preparing for your MCCQ1, especially your USMLE, burns is a very, very important topic. So we're going to get right into it. So please, those on YouTube, if you can see my screen, just let me know. And those on TikTok as well, if you want to see the screen, just go to YouTube, go to MedCognito on YouTube, MEDCOGNITO, and you will get it. Oh, we have people joining us from Hong Kong. So doctors, just join us from everywhere. Let's start studying right away. So let's get into it. Approach to burns. How will we approach a case of burns in the exam? Okay, so the first thing we have to understand is the rationale. We need to really understand the rationale for this. Okay, so burns are fairly common injury to the skin and other tissues. Okay, and depending on the severity, they may be life-threatening or fatal. That's something you have to understand. So when you're preparing for these board exams, you have to always understand that they are looking at your approach to life-threatening, limb-threatening conditions. And from the objective, you realize that the rationale states that burns can be life-threatening or fatal. Now, what are the causal conditions of burns? What we have to understand is that the burns people can experience can be thermal, there can be electrical burns, there can be chemical burns, and there can also be radiation burns. Okay, so we have all these kinds of burns which can affect a patient. Thermal burns, electrical burns, chemical burns, and radiation. Now, given a patient with burns, and for those on TikTok, if you want to see the presentation itself, we are sharing the slides on YouTube. So you can go to YouTube on MedCognito and you will see the slides itself. Okay, good. So the objective is that given a patient with burns, the candidate will diagnose the severity and will manage any complications. So one thing you have to understand in your board exam for the Canadian board is that you have to understand how to determine the severity of a burn. And today we will deal with that in class, okay? And you must be able to manage any complications of burns. And in particular, the candidate will institute initial management of major thermal burns. So you must know how to deal with that in your board exam, okay? Now, I go on. It says, given a patient with burns, the candidate will list and interpret critical clinical findings, including Number one, the severity of burns. Number two, the depth of burns. Number three, the extent. So that is where you realize that in your classes, you are taught how to calculate how much percentage of burns depending on which body part is burned, right? And today we will deal with that as well, and we'll look at some questions we need to be able to deal with. Now it says the risk of associated inhalation injury or other associated clinical problems, and the patient's tetanus immunization. So whenever you have a patient with burns, you have to also make sure that you've dealt with the concerns about tetanus. You have to always keep that in mind. Tetanus. Okay. Now, list and interpret critical investigations, including laboratory and imaging investigations, and construct an effective initial management plan. Okay. Including resuscitation and stabilizing the patient, including the use of appropriate intravenous fluids. So that's also something very important. Whenever you have a case of burns, your board exam expects you to be able to use the body surface area of burns to determine how much fluid a patient will get. And we have somebody who is joining us from Windsor, Ontario. Someone else is joining us from Atlantic, Canada. Beautiful. So again, those on TikTok, if you want to see the presentation itself, the slides, it is on YouTube. Okay, go to MedCognito on YouTube. You'll see it there. Okay, good. Now, you must also address wound care. You must address physiologic monitoring and pain control. So if you have a patient who has developed burns, how do you manage the patient's pain? And determining whether the patient requires specialized care, okay? And anticipating medium-term and long-term complications of burns. So these are the things you need to know if you want to master burns. What are the complications? How do I resuscitate a patient? How do I manage a patient with inhalational burn? How do I estimate the body surface area so far as burns are concerned? So how are we going to think about burns? How are we going to think about burns? Burns are not just things which happen from the flame. We have to understand that burns are not just what happens from maybe fire. Burns can come from chemicals. And today we will take our time and differentiate between alkaline burns and acidic burns. And burns can also come from electrical activity. And burns can also come from friction. Maybe the skin is dragged on a particular rough surface, right? And then burns can also come from radiation. Okay? So, what about the mechanisms of burn injury? Mechanisms of burn injury. It can come from heat, it can come from chemicals, it can come from electricity, from friction, and from radiation. Okay, so let's talk about heat. So those on TikTok, if you want to see the presentation itself, the PowerPoint slides, please go to YouTube. Just type MedCognito on YouTube. It is there, and subscribe to the YouTube channel as well. So when it comes to heat or thermal burns, okay, the damage depends on the contact temperature. So what is the temperature which is causing the burn? Number two, how long the patient's skin was exposed to the heat, and what was the skin's thickness? So let me take it again. What are the factors which determine the extent of heat burns? Number one, what was the temperature of the heat source? Number two, how long was the skin exposed to the heat? Number three, what is the thickness of the area of the skin which was exposed to that heat? Okay, now common sources of thermal burns can be flames. It can also be hot liquids. It can be hot solids and steam. So these are the common sources of thermal burns. So thermal burns, there's a way we classify them. And remember these four classifications. We have number one, first degree burns. Number two, we have second degree burns or partial thickness burns. Number three, we have third degree or full thickness burns. And last but not the least, we have fourth degree burns. So remember, we have first degree, second degree, third degree, and fourth degree. But at the same time, first degree is considered what we call superficial burns. And then second degree burns are what we call partial thickness burns. And then the third degree burns are what we call the full thickness burns. And then the fourth degree is what we call fourth degree. Now, how do we differentiate the different types? What you have to understand is this. How to differentiate the various types. This is how we have to understand it. Number one, first degree burns affect only the epidermis. That is the surface skin which we see. Okay, and usually the patient may have red, painful. Usually there are no blisters, and first degree burns will heal between 5 to 10 days. So please, I need you to write this down in your book. First degree burns, they usually heal between 5 to 10 days, and they affect only the epidermis only. First degree burns, they affect only the epidermis. Now, second degree or partial thickness burns, they affect the epidermis and the dermis. The epidermis, that is the surface skin, and then the skin which is underneath it. Okay, and with the second degree burns or the partial thickness burns, what happens is that you see blisters, you see that the patient has intense pain. Let me take it again. First degree burns affect only the epidermis. Second degree burns or partial thickness burns affects epidermis and dermis. And with that, there's blisters, there's intense pain. And then third degree burns, which we call the full thickness burns, it affects all the skin layers. Epidermis, dermis, even the fat underneath it. And usually you realize that the patient will develop like a white or brown leathery texture. Okay. And most of the time, third degree burns are painless. Why? Because there's damage to the nerves. So third degree burns are usually painless. Fourth degree burns, it goes beyond the skin. And now it is affecting things like the muscle and the bone. And so you realize that the area of the burn is very black. It is charred, like, very, very burnt. And there's no sensation at all. So now, after we've gone from the thermal burns, let's go to electrical burns. So when there's current applied, when there's current applied to the skin, what happens is that it will hit the tissue inside, and it causes what we call electroporation, which means the membrane is disrupted. Please, I'm showing some pictures on YouTube. So if you want to, see the pictures and the slides, especially for those on TikTok, you can go to YouTube and see it. Okay. So the electrical burns, and you can just check MedCognito, MEDCOGNITO. Okay. So the severity is dependent on the path of the current and the tissue resistance, because there are various different tissues of the human body, and each of them have various resistance they can have towards electrical activity. Okay, it can also depend on the current strength and then how long that electrical activity was on the skin. One thing you have to understand about electrical burns is that it can cause deep internal burns which are not visible on the skin. Okay, because it can go beyond the skin and cause damage to the area underneath where the problem is. So in electrical burn, what will happen is that you will see that the area is charred, like, it looks like very dark. It has a charred center, especially where the electrical activity went through the skin. It has a pale rim and there's surrounding redness. Usually, because it can penetrate deep into the skin, the effect is felt really deep, and it can extend to the muscles, the nerves, and the bone. Okay, and what are the risk factors? How do we determine the severity of electrical burns? It depends on the voltage level. It also depends on the duration of contact, how long that electrical activity was going on, and it depends on the tissue's resistance. And what are complications? I need you to write this down. Complications of electrical burns. Complications of electrical burns. I'm going to give you 4 complications. I need you to write it down. 4 complications. The first complication is that electrical burns can lead to compartment syndrome. It can lead to compartment syndrome. The next one is that electrical burns can lead to rhabdomyolysis. That is breakdown of the muscles. Rhabdomyolysis. So it can lead to compartment syndrome where there's excessive pressure buildup in the muscles. Number 2, it can lead to rhabdomyolysis. That is breakdown of the muscles. Number 3, it can also lead to cardiac abnormalities. And number 4, it can lead to neurologic injury. So neurologic injury, cardiac abnormality, compartment syndrome, and rhabdomyolysis. These are the 4 complications of electrical burns that I need you to remember. Okay, so let me unshare my screen. Please, what are the 4 complications? Kindly type it in the in the comment section. What are the 4 complications of electrical burns that I want you to remember? Those on TikTok, please type it, and those on YouTube as well. What are the 4 complications? Because this one, I need you to remember it. Please, I need you to remember this. I need you to remember it. What are the 4 complications we just talked about of electrical burns that you need to learn? You know, that you need to learn for your board exam. Good. Compartment syndrome. Beautiful. Beautiful. What else? What else? Cardiac abnormality. Beautiful. Beautiful. What else? Rhabdomyolysis. Rhabdomyolysis. Those on TikTok, please type in the comment section. So rhabdomyolysis, compartment syndrome, cardiac abnormalities, and neurologic abnormalities. Beautiful. Idrisu, wow, so many people have sent in the answer. So Idrisu says compartment syndrome, rhabdomyolysis, neurologic injury, and cardiac abnormalities. Okay, good. Let's move on. What about frictional burns? Because we are looking at the various causes of burns. Frictional burns, you know, where there is tissue tearing. Maybe the person was dragged on the road or something, you know, where there's tissue burning. And there is heat from rapid movement. As I said, the skin gets in touch with the floor, the person is dragged, and heat is produced. And this is usually seen in maybe road rash or, you know, motorcycle accidents. Then the other kind of burn I want you to remember is chemical burns. Chemical burns. Chemical burns. Chemical burns, you have to understand that there are 2 main types of chemical burns. It can be an acidic burn or an alkaline burn. An acidic burn or an alkaline burn. And I've showed you pictures on YouTube. Okay, there are pictures which are showing on YouTube. So if you're on TikTok and you don't see the pictures, please come to YouTube. You see it. So remember this, please write this down. Acidic burns cause coagulation necrosis. Please write it down. Acidic burns, they cause coagulation necrosis. And in coagulation necrosis, what that means is that the tissue proteins will clump together and they will create a barrier. But in alkaline burns, they develop what we call liquefaction necrosis. So while acidic burns are causing coagulation necrosis, alkaline burns are causing liquefaction necrosis. In liquefaction necrosis, what happens is that the tissues will dissolve, and because of that, there's a deeper spread. So when it comes to acidic burns versus alkaline burns, the one which can go really, really, really deep, please, who can guess it for us from the explanation we've given? Acidic burns versus alkaline burns, which of them can go very, very deep? Acidic burns or alkaline burns, which of them can go very, very deep, please? Beautiful, beautiful. Dr. Brooks says it will be alkaline burns. Why? Because alkaline burns cause liquefaction, while acidic burns cause coagulation necrosis. Okay, so what determines the severity? It is how long the person's skin was exposed to the chemical. It's also dependent on the concentration of the chemical and the chemical type. And the other point is that there can be extra risks associated with that, because if your skin absorbs a chemical, what can happen is that it can become systemic and it can lead to life-threatening toxic effects. Okay, and it can destroy full thickness skin. Then the next kind of burn I want us to talk about is radio frequency burn or radiation burns. This can come from UV radiation. So like patients who go to Bali, they go on vacation and they are just in the sun, right? They can get a lot of radiation burns. And it could also be from patients who are getting therapeutic radiation. Maybe the patient has some form of cancer going through some radiotherapy, right? That can also be a problem. And then it can also be diagnostic overexposure. So the patient's exposed to many radiations for diagnostic purposes. And it could also be due to nuclear industry accidents. Nuclear industry accidents. So how do radiation burns evolve? Usually when there's radiation, it causes DNA damage, and that will lead to cell death and deep injury with high protein energy. Okay, and the severity factors are: what is the dose of that radiation which was given? Number 2, how long was the skin of the patient exposed? Number 3, what is the particle type? The type of radiation. Okay, and the complication of radiation burns is the risk of skin cancers and other forms of cancer. So with all this, doctors, I have a question. Please, did it make sense so far? Does it make sense? We are going to solve some questions. So if you want to engage in the questions and you're on TikTok, kindly come to YouTube as well, and then you see the questions. But so far, has it made sense? I want to know. Those on TikTok, those on YouTube, those on Facebook, has it made sense? And those who are joining us on YouTube, kindly click on the like and the subscribe button so that we can keep growing. We can keep growing. We can keep growing. And the more we grow, the more other doctors and nursing students and other people can also see the content. So please, did the class make sense? Okay, sure. So a lot of people are saying yes, it's clear. Okay, so now let's solve some questions. Let's solve some questions. First question. You have a 42-year-old electrician who is admitted after accidentally contacting a high voltage wire. On examination, there's a small skin entrance wound, but the latter develops deep muscle necrosis along his arm. Which factor most likely determined the extent of his internal injury? If you want to see the question, I'm showing it live on YouTube. You can go there and you see the question as well. Okay, just type MedCognito on YouTube. You'll see it there. Okay, so A, the amount of subcutaneous fat at the entry site. B, the concentration of electrolytes in his blood. C, the pathway of electrical current through the body. D, the thickness of his epidermis at the contact point. And E, the degree of skin hydration before the injury. On TikTok, Son of Wisdom, you're giving us thumbs up. I'll give you thumbs up as well. I'm replying you while we solve the questions. Awesome. So if you send a message on TikTok as well, I'll reply. And if you want to see the questions, we are loading them on YouTube. I don't know how to share it on TikTok. So on TikTok, I can just show my face. So I see a lot of people going for C. And the correct answer is C. The pathway of electrical current through the body is what can at times determine the severity. Let's go to the next question. You have a 60-year-old farmer who is exposed to an industrial alkali that splashes onto his forearm. Despite immediate washing, tissue destruction continues to deepen over the next few hours. Which process best explains this progression? A, coagulation necrosis, limited penetration. B, liquefaction necrosis allowing continuous spread. C, electroporation of skin cell membranes. D, protein denaturation without membrane rupture. And E, DNA cross-linking with ionizing radiation. What's the correct answer? Is it A, is it B, is it C, is it D, or is it E? What's the correct answer? What's the correct answer? Okay, I see a lot of doctors going for B, and the correct answer is B. Remember that we said alkaline burns can lead to liquefaction necrosis. Okay, and with liquefaction necrosis, it spreads deep. I have a question. What kind of burn do we get in acidic burns? We've learned that alkaline burns will lead to liquefaction. Okay, now what kind of burn is seen in acidic burns? Please type the answer. Type the answer, please. Type the answer. What kind of burn is seen in acidic burns? Please type the answer. Those on TikTok, I'm waiting for your answer. What kind of burn is seen in acidic burn? Beautiful. And I see Dr. Idrisu, Aishu, Emmanuel, Dr. Kusanya. So in acidic burns, we have coagulation necrosis. In alkaline burns, we have liquefaction necrosis. Okay. Next one, next question. A patient receiving radiation therapy for cancer develops a burn over the treated area. Which factor most influences the depth of this radiation burn? A, the patient's age and skin thickness. B, the cumulative radiation dose and photon energy. C, the presence of alkali residues on the skin. D, the electrical resistance of underlying tissues. And E, the pH of the surrounding tissue fluid. Which of the following most influences the depth of this radiation burn? The depth of the radiation burn. Those on TikTok, as again, if you want to see the presentation, just go to YouTube, type on MedCognito, you'll see the whole presentation and the slides as well. Okay. So the answer is B. The depth of radiation injury is determined by the dose, the time, and the particle and photon energy. Okay, good. So how can we classify burns by depth? By depth. How do we classify burns by depth? Now, remember that the objective of the exam, you are expected to know this particular thing. So I want you to take this particular part very seriously. Burns are classified by how deep the damage goes. How deep the damage goes. And doctors, please kindly click on the like and subscribe button on YouTube. Like and subscribe, like and subscribe, like and subscribe, like and subscribe. Okay. Now, the depth of the burn determines, number one, the healing potential of that burn. Number two, it also determines the complications of the burn. And number three, it determines whether surgery is needed for the burn or not. Okay. These three things: healing potential, complications, and whether or not we need surgery. So you realize that initially we had first degree, second degree, third degree, and fourth degree. But now they've changed the nomenclature a little bit. I even introduced it when the class started. We have superficial partial thickness, deep partial thickness, full thickness, and fourth degree burns, which are deep tissue burns. Okay, so what you have to understand is that many burns are mixed. Okay, they are the mixed type. So some principle that I want you to remember is that the deeper the burn, the slower the healing, and the more the scarring, and the higher the chance that you may need to graft. And grafting is basically taking some skin from another part of the body and putting it over the burn surface. Okay, so some thin burn surface areas you have to know is the volar forearm, and then the medial thigh, so in between the thigh. Okay, and then the perineum, so the perineal region, the anal region, where the scrotum, like the perineum. The skin there is thin, as well as the ears. So whenever there's a burn to any of these areas, what I need you to remember to manage is that this person may have a deep burn because the skin around the area is light already. Okay, good. Who are the high risk people so far as burns are concerned? When there's a burn, who do we consider high risk? Number one, children who are less than 5 years of age, and adults who are more than 55 years. So just think about it, extremes. Who is more vulnerable during a burn? Children and elderly people. And the reason is because in the elderly people, they even have thinner skin. Okay. Now, the depth of the burn can change over days. It can change over days. And different areas in one burn wound may require different treatment. So you can have a patient who has burns all over the body, but the kind of treatment which may be given to the face may be different from the treatment which may be given to the chest. So now let's look at the kinds of burns in terms of their depth and do some revision there. So we have superficial burns or epidermal burns. This one affects the epidermis only, and the patient will present with painful, red, dry skin which blanches with pressure, and there are no blisters. Okay, now usually the redness will fade after 2 to 3 days, and they peel by day 4, and by day 6 they are healed totally. Usually the common cause of superficial epidermal burns is sunburn. And one thing you need to understand about superficial burns is that there is no scarring. No scarring. Please remember, superficial burns, no scarring. No scarring. Superficial burns, no scarring. Okay? Good. Next one, when we go to the partial thickness burns, we have 2 types of partial thickness burns. We have superficial partial thickness and deep partial thickness. Let me take it again. Superficial partial and deep partial thickness. Now, let's talk about the superficial partial thickness burns. This affects only the epidermis and the superficial dermis. Epidermis and superficial dermis. Blisters form within 24 hours. They are red, weepy, painful, and they blanch with pressure. Usually, they heal within 7 to 21 days. And there may be scarring, but it is rare. But then there's a possibility that the skin color may change. Okay? The skin color may change. And you are not expecting any long-term functional loss in those patients. So I've given you a picture of superficial partial thickness burns. If you're on TikTok and you can't see the picture, please come to YouTube. You will see the picture there. Okay. What about deep partial thickness burns? These are the kinds of burns which extend into deeper dermis, into the deeper skin. Okay. And it damages the hair follicles and the glands. And so when you apply pressure, there is pain. And it is wet or waxy, dry, and there is mottling white, it looks like mottled white, and there's sluggish blanching. Okay. Usually, if you're looking at the timelines, it heals in 2 to 9 weeks if there's no grafting. And there's high hypertrophic scarring rate. So it can heal, but then there can be hypertrophic scar. Okay, good. Now, let's go to the next level. The next level is what we call the full thickness burn. This one, it destroys all the dermis, and it can go even into the subcutaneous fat. It destroys all the dermis, and it can go into the subcutaneous fat. Okay, so you realize that at times when you touch the area, the patient does not even feel it because all the nerves have been destroyed. There's waxy white, leathery gray, or charred, dry, inelastic, and there's no blanching because it's gone deep. There are no blisters. The hair pulls out easily. That is full thickness burns. So you realize that if you look at the picture on YouTube, the eschar separates. The eschar is the top value, the top area. It can separate over time. And what can happen is that it can reveal the granulation tissue. In full thickness burns, the patients need grafting. You need to graft the area. So you need to pick some skin from another place and come and put it there. And it will heal by contracture if you don't treat it properly. And there can be severe scarring. And then let's talk about the 4th degree burns. So you realize that when you look at the 4th degree burns, those on TikTok, you realize that if you come to YouTube and you see the pictures, it's very bizarre, right? It's gone through the skin, it's gone through the subcutaneous tissue. It may involve the muscle, the bone, and the joints. 4th degree burns are threatening, life-threatening, and they require extensive surgery. That's something I want you to remember. 4th degree burns, they require extensive surgery. Extensive surgery. Okay, so this is just a table, and I'm not going to bore you with it. It's the same thing I talked about, but I'm just going to share it so you can take a screenshot. Okay, this table summarizes everything we've talked about, from superficial, partial, deep partial, and then on and on and on. 4 thickness and then a 4th degree. Okay, so you have to know which one affects bones and deeper tissues, which one does not cause blisters and the rest. Okay, so if you want to remember the degrees of burns, what I want you to remember is this acronym. Some people do feel fire. Some people do feel fire. Some people do feel fire. Superficial is for the some. People, partial thickness. Deep, that is do. Deep, partial thickness. And feel, that is full thickness and 4th degree. So some people do feel fire. Some people do feel fire. So now, let's do a quick review. You have a 25-year-old with sunburn. It's painful, it's dry, it's red, it blanches, it heals in 5 days without a scar. What is the degree of burn? 25-year-old was exposed to the sun. Okay. Painful, dry, red, it blanches, it heals in 5 days, but there is no scar. What is the degree of burn? What's the degree of burn? What's the degree of burn? What's the degree of burn? So it is superficial burn. Okay, superficial burn. Next one. You have a 55-year-old with mottled, sluggish blanching, waxy burn, which is near the elbow, pressure pain only, and it heals in 8 weeks with scarring. What kind of burn does this patient have? 55-year-old with mottled, sluggish, blanching, waxy burn near the elbow. Pressure when you apply, pain only. It heals in 8 weeks with scarring. What kind of burn is that? Okay. Dr. Ronnie says 4 thickness. Who else has a different answer? So the answer is a deep partial thickness. So Dr. Mosima, you got it right. Deep partial thickness. Afghan TV magazine, you also got it right. Okay. Now, which burn type has dry, inelastic, anesthetic skin? Dry, inelastic, anesthetic skin. Those on TikTok, please, I'm waiting for your answers. Which burn type has dry, inelastic, anesthetic skin? Which burn type has dry, inelastic, anesthetic skin? Which burn type? And the answer is full thickness burn. Okay, I have a question. Why are kids less than 5 and adults more than 55 years at higher risk for deep burns? Why are kids less than 5 and adults more than 55 years of age, why are they at higher risk for deep burns? Good. People are getting it. So Dr. Melanie, Afghan TV, it is because their skin is thin. Their skin is thin. Their skin is thin. Okay. Next question. So you have a 48-year-old woman who sustains burns over her back in a house fire. Some areas are dry, leathery, and anesthetic, while others are blistered and painful. Which of the following is the most important implication for her management? A, she has only 4 thickness burns, so surgical grafting is unnecessary. B, her burn wounds are dynamic and may require multiple treatment approaches. C, she will have complete spontaneous healing without contractures. D, the absence of blanching means the wounds will heal in less than 10 days. And E, the skin areas are less likely to have deep burns. What is the correct answer? I see a lot of doctors typing B, B, B. And the correct answer is B, B, B. So her burn wounds are dynamic and may require multiple treatment options. And that's what I was teaching you last time, okay? Burns usually are mixed type. So you can have maybe partial thickness burn on the front, on the face, and you can then have full thickness burn on the leg, right? So when you are dealing with the person, you don't use the same treatment methodology. You have to treat the patients based on the dynamics there. Now, why should you master the size of a burn? Why? You remember that in the objectives, they said it, right? Do you remember, please? Doctors, do you remember? Yes or no? Yes or no? Yes or no? Yes or no? Do you remember that the objectives talked about the fact that you must be able to assess. You must be able to assess the depth of burns. Do you remember that? If you remember, just type yes, yes, yes. Just type yes, yes, yes. Okay. So if you remember, let's go. Why should we learn to estimate the size of burn? Why? Why should we do that? We have to do that because estimating the size of burn is critical because we need it for fluid resuscitation. That's number one. Number two, we also needed to know this patient, does the patient need to go to a burn center or not? And number three, it guides the overall management of the patient. So let me say it again. Why should we estimate the size of a burn area? Number one, for fluid resuscitation. Number two, it helps us to decide whether we are going to transfer the patient to a burn center. And number three, it guides overall management of the patient. So doctors, realize that there are things you need to know that if I see this patient needs to go to a burn center. Okay? So what counts towards total body surface area calculation in burns? Is it a superficial burns part? Is partial thickness burns part? So what actually counts if you are doing the body surface area of burns, which and you need to do calculation? Remember, only partial thickness and full thickness burns counts toward total body surface area calculation. So superficial burns don't count. Please take it from me. Superficial burns don't count. The only ones which count are partial thickness burns and full thickness burns. Let me say it again. The only kinds of burns which count towards total body surface area calculations in a patient with burns is partial thickness burns and full thickness burns. Superficial burns are excluded. Okay, so now there are three ways we estimate the extent to which a patient has been burned. We have the Land-Browder chart, we have the rule of nines, and we have the palm method, okay, where we measure the extent of burn with the palm. Okay, now the accuracy can be influenced by various things: the patient's age, the patient's body habitus. Is the patient bigger? And the breast size, because if the breast size is large, that increases the surface area, right? Okay, good. So let's talk about the Land-Browder chart. Of all the charts, it's the most accurate in both adults and children. Please. Number 2, the Land-Browder chart adjusts for body proportions that change with age, because the body proportions will change with age. You realize that when a child is younger, their head is proportionally bigger as compared to the rest of the body. But as we grow up, the body takes shape and the head becomes relatively smaller as compared to, the rest of the body. So children have a larger head percentage, smaller leg percentage compared to adults, okay? And if you are looking for a place where you should be using the Land-Browder chart more, it should be in pediatrics. It should be in children. So I'm just sharing this with you. You don't need to memorize the numbers, but this is why it is very, very accurate. The chart that you need to memorize the numbers is the rule of nines. Okay? The chart that you need to memorize the numbers is the rule of nines. So this is what I was talking about. So we've learned the Land-Browder. That is the most accurate form. But the rule of nines also helps us. So with the rule of nines, let's start with adults. The head is 9%. The torso is 18%. The back is also considered 18%. The arm is considered 9%. The other arm is also considered 9%. Okay. Now, the leg, from the thigh downwards, the leg. Where is it? The leg is considered 18%. And then the perineum is considered 1%. So I have a question. In your board exam, if I say only the anterior face was burned, what percentage of the body would you say was burned? If I say only the front part of the face was burned, what percentage of the body will you say is burned? Looking at what we've learned today. Please, those on TikTok. If I say only the face was burned, not the whole head, what percentage will you use? Beautiful. I've seen people choosing 4.5%. Beautiful. This is where people are tricked. Okay, what about if I say it is just the anterior thigh? The anterior thigh, which was burned. Just the anterior thigh, which was burnt. The anterior thigh. Anterior thigh. Beautiful. Beautiful. The nomad says 9%. Beautiful. Okay. What about if I say the upper chest, excluding the abdomen? The upper chest was the only part which was burnt. Upper chest. Upper chest. What's the total percentage? Upper chest. Upper chest. Upper chest. Beautiful. 9%. Beautiful. Okay, so now let's do some more complex ones. What about if I say the right arm, the entire right arm, the anterior part of the right leg, the entire right arm, the anterior part of the right leg, and the perineum? These were the only places which were burnt. The right arm, the anterior part of the right leg, and the perineum. What's the total percentage burn? The perineum, the right arm, and the anterior part of the leg, of the right leg. right arm. So the right arm is how much? 9%, right? Anterior part of the right leg is another 9%. That makes it 18. And the perineum is 1%. So that makes it 19%. Beautiful. Doctors, please, are we getting it? Because I really, really want to make this thing very simple for everybody. Are we getting it? Are we getting it? Are we getting it? Those on TikTok, are we getting it? Are we getting it? I really want to know, are we getting it? Beautiful. We need to, in a later class, deal with burn fluid calculations. But I need you to understand this because in a board exam, you can be tricked. You can say maybe anterior face or half of the anterior face. So if it is half of the anterior face which was bent, half of the anterior face which was bent, what would be the percentage bent? Half of the anterior face which was burnt, half of the anterior face which was bent, what will it be? Remember, the anterior face is 4.5. So half of the anterior face is what? 4.5 divided by 2. Right? So it will be 2.25. Beautiful. Dr. Joanna De Cruz. Beautiful. Because the anterior face alone is 4.5. The whole head is 9%. So if it's the anterior face, it will be 4.5%. Then if I say half of the anterior face, that will be 4.5 divided by 2. So that will be 2.25. Okay, good. So it looks like we are getting it. So that is it. Now the palm method. The palm method is a quick way of assessing degree of burn. Okay, so it is used for small and patchy burns, and the palm is considered as just 0.5% total body surface area. Okay, so the entire palmar surface with the fingers. So the palm that is here without fingers is 0.5. But if you are doing a calculation, you add the fingers, it becomes 1%. And we can use it in both children. So if somebody has a burn, you can use the palmar method to just estimate. Okay, one, like, you can use it to just estimate, but that gives you just a rough estimate. Okay, so how to remember the various methods? Remember, we talked about land and brother, rule of nines, and the palmar method. I have a question, doctors. Which of them is the most accurate of these three? Which of them is the most accurate? The most accurate of the three. Which of them is the most accurate? Is it the land brother? Is it the rule of nines? Or is it the palmar method? Which of them? And please, if you've not subscribed to our YouTube channel, kindly go to YouTube and subscribe right now. Okay, we are doing the most at MedCognito for the whole IMG community. So what we expect from you is to subscribe and support the good work we are doing. Okay, good. So just subscribe. We are currently at 3,118 subscribers. Please move us to 3,200 subscribers on this live right now. 3,200 subscribers on this live right now. So please, everybody, go to YouTube and subscribe. Good. So the land browser is the most accurate of them all. Okay, good. So let's do a quick quiz. In rules of nines, each adult leg is what percentage total body surface area? Rule of 9. Each adult leg is what percentage total body surface area? In the rule of 9, the leg, beautiful, that is 18%. Beautiful. Next question. You have a 3-year-old boy who sustains scald burns over the head, the anterior trunk, and the entire left arm. Which method is most appropriate to accurately determine the total body surface area burned? A, rule of 9. B, land browser chart. C, palmar method. D, use the adult rule of nines and subtract 9% from the legs. E, visual estimation based on referring hospital report. Please, those on TikTok, I hope you're also following the class. Are you following the class? Those on TikTok, I hope you are following the class. Those on TikTok, I hope you're following the class. Okay, so doctors, I'm waiting for your answers. I'm waiting for your answers. So the correct answer is B. The Land-Bowder chart is the most accurate. Okay, good. A patient with circumferential full thickness burns over the right leg is admitted to the burn unit. The referring hospital estimated the total body surface area burn as 9%. At the burn center, the total body surface area is calculated at 18%. Which of the following is the most important clinical consequence of the initial underestimation? A. Overresuscitation and fluid overload. B. Inappropriate use of the palm method. C. Delay in performing escharectomy. D. Under-resuscitation and inadequate perfusion. And E. Excessive use of skin grafts. So in one center, they did the calculation, total body surface area burn, and they said it was 9. But when the patient got to the burn center, they said that the total body surface area burned was 18%. Which of the following is the most important clinical consequence of the initial underestimation? Why was it what's the consequence if you underestimate a patient's total body surface area burn? And the correct answer is D. If you underestimate, what will happen is that you will under-resuscitate. It's very simple. If you underestimate the total body surface area burns, you will under-resuscitate. And because of that, the patient will not develop adequate perfusion. Then, if you're not careful, the patient will be going into shock. Okay? So, we're going to get into the part where we have to know indications for referral of a burns patient to a specialist. Remember that the objectives, they always talk about the last point. They always talk about when will you refer? When will you refer? When will you refer a patient? When will you refer a patient? Okay? When will you refer a patient? So, I just want you to remember the new MCQ1 score is 439. Okay? The lowest score anyone can get is 300. The highest score anyone can get is 600. The pass mark is 439. And if you get 30 points above the pass mark of 439, so that is 469, that means you've gotten plus 1 standard deviation above. Okay? If you get an extra 30 marks, then you've gotten 499, then you got plus 2 standard deviations above. Okay, so in the last exam, we have some people who scored 524. Powerful. Okay, 524 points. We also had people, someone says they scored 447. So Dr. Bonnie, I got 447. I kept hearing your voice with me in that exam. So doctors, if you want that to be your your experience, that's what MedCognito is here for, right? Good. Another person scored 455. I passed the QE1, Dr. Bonnie. I passed. This, it's so much joy when people share these thoughts with us. And that is why we do what we do. And if you want extra tutoring, okay, where you're going to get classes every Sunday evening, every Thursday evening, every Sunday afternoon, like what I'm doing now, a tutoring system which has mock exams for you in the portal so that you can do the mock on your own. And then you also have live mock exams that you will do every 2 weeks. So we have one coming up this week. Doctors, MedCognito is a place to go. As well, we have what you call Med Bullets. So Med Bullets is like, your final revision of revision. We've done all that for you. All you need to do is to, boom, plug in and get a game going. Okay? Good. So another one scored 459. I'm just letting you know that, look, it is possible. It is possible. It is possible. And that is why we are doing what we do. Doctors, that is why we are doing what we do. Okay? So these are some of the students who passed and then they just shared their testimony. It's live on our YouTube channel. So you can go there and then watch it and, listen to some of the resources. We have people from Nigeria, Pakistan, India, Hong Kong, Ghana, South Africa, Iran, Afghanistan, everywhere, Hong Kong, UK, who are taking the course with us and they are blowing the exam. So doctors, we are here for you. Just give me a call after this class at +1 306 891 5649 +1 306 891 5649. And there are so many videos on our YouTube channel. We have more than 700 videos. So if you also want to review some stuff, you can go there. As well, on our YouTube channel, we also update you on all the new changes, right? If there's any change, we update you there. So our YouTube channel is a place you don't want to miss. Okay, sure. So someone says, I honestly can't thank you enough, sir. God bless you and the entire team. So it's awesome. Okay, so let's talk about indications for referral to a specialist, and we'll bring the class to an end. When do you get a patient who has developed burns to a specialist? What I want you to know is the indications for immediate consultation. That's what I want you to learn. The indications for immediate consultation. Number one, if it's a thermal burn and the patient develops full thickness burn, you need to consult a specialist. If there is a partial thickness burn and it is more than 10% of the total body surface area, boom. That's why we took our time to learn how to estimate the size of burn based on the various methods, Land and Browder, the palm method, and then the rule of 9. Remember the palm method, if you are using the palm alone without the fingers, it is 0.5. But if you're using palm and finger, it is 1%, right? So full thickness burn, you must consult. Partial thickness burn, which is more than 10% of the total body surface area, you must consult. Any deep partial or full thickness burns involving the face. If there's facial burn, consult a specialist. If there's hand burn, hand burn, consult a specialist. If it affects the perineum, please contact the specialist. If it affects the feet of the patient, okay? If it affects the feet of the patient, please contact the specialist. Okay? If it affects the genitals, the vagina, the scrotum, please consult a specialist. Please consult a specialist. Consult. I think somebody just sent us a TikTok gift. Thank you so much. Somebody sent us a TikTok gift. Thank you. So those on TikTok, if you want to send us gifts, we will appreciate it. Okay. So please, what are the indications? Indications for referral. Indications: full thickness burn, partial thickness burn, more than 10% total body surface area. Any deep partial or full thickness burn involving the face, the hands, the genitalia, the feet, the perineum, or if there is a burn over any joint. So if there's a burn over the knuckles, any joint, contact a specialist. If you have a patient with burns who has other comorbidities, maybe burns in COPD, burns in a diabetic, burns in a patient with congestive heart failure, burns in a patient with coronary artery disease, burns in a patient with HIV, burns in a consult. Patients with concomitant traumatic injuries. So they have burns, and while they were being burnt, they also developed some traumatic injuries as well. Please consult. If you also have a patient whose burn is poorly controlled, consult. Doctors, please, before I move on, these are critical exam points we are raising tonight or this afternoon. Critical exam points that we are raising. Indications for referral. Please, talk to me. What are the indications? We started with what? Any deep burns, full thickness burn, partial thickness more than 10% total body surface area. Any deep partial or full thickness burn involving the face, genitalia, feet, palms, perineum, over the joints. Patient who has comorbidities, right? Patient who has concomitant traumatic injury. Patient who has poorly controlled pain. You want to consult. Now, what about inhalation injury? All patients with suspected inhalation injury, consult. The reason is because their airway can easily collapse. Consult, doctors. Don't waste time. If you see a patient in your board exam and you are told that that patient developed inhalation injury, maybe there's singing of the nasal hair, and then you see the face, there's soot in the mouth, there's smoke in the mouth, please consult. Don't waste time. Doctors, consult. Please consult. Okay, what about pediatrics? If you have a patient who is less than 14 years or someone who is less than 30 kilograms, all inhalation injuries we've learned we have to consult. Now, all pediatric burns may benefit from burn center referral due to pain, dressing change, and needs for rehabilitation, patient and caregiver needs, and non-accidental trauma. So consult. All pediatric burns, all inhalational burns, consult. All chemical injuries, consult, especially alkaline injuries, because we said that alkaline injuries can cause liquefaction necrosis. Meanwhile, acidic injuries can cause coagulation necrosis. Okay? And then, so we've learned all chemical injuries, all inhalational injuries, all injuries in patients who are less than 14 years or who are less than 30 kilograms. Consult, 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 consult. And electrical injuries, all high voltage injuries, which are more than 1,000 volts, consult. And if the patient was stricken with lightning, doctors, don't just keep the patient in your local hospital. Consult. So, in a future burns lecture, we will now take all this knowledge and we will take it into how to do calculations in a patient with burns. Doctors, I have a question. Please, how was the class? How was the class? I want your feedback. Those on TikTok, those on YouTube, those on Facebook. I want your feedback. How was the class today? How was the class? How was the class? How was the class today? How was the class? How was the class? How was the class? How was the class? Dr. Chona Anyoha says awesome. Good. Some saying great. Beautiful. Those on TikTok, how was the class? Indications for referral. So, doctors, if you want to hear from us, just send us a WhatsApp +13068915649 +13068915649. We've had so many people consulting us. I'll take time today to make sure that we respond to everybody. If we don't respond to you today, know very well that you hear from me tomorrow. Doctors, thank you very much for those who joined us on TikTok. Thank you for those who joined us on Facebook. Thank you for those who joined us on YouTube. Thank you very much. It's going to be on our YouTube channel right now. It's going to be there, so you can go there and revise. Tonight, we are also meeting and studying again. We are doing med drills. Med drills. We are doing it. So those who have registered with MedCognito and they are taking their course with us, med drills. Please, if you want to join MedCognito, +13068915649 +13068915649. Let's meet and enjoy the studies. All the best. Good night. Bye-bye. Bye-bye. Bye-bye.